Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. With the holidays upon us, many of us are taking extra trips to the table and putting a little more of our favorite dishes and sweets on our plates, but all of that can cause acid reflux and indigestion, which can sour your holidays. ExpressCare's Dr. Jitka Lom joins us now with some tips on how you can prevent indigestion and control acid reflux to enjoy your holidays and all the good food that comes with it. Thanks, Doc, for coming in.
Sure.
So what causes indigestion?
Well, typically it's two things. One, too much food in your tummy, and second, too much food going in the wrong direction. So normally when we eat, we digest our food by chewing, then the food goes down our esophagus, then it remains in our stomach, and there's a valve that closes, or a sphincter, I should say, a sphincter that closes at the bottom of the esophagus, sort of tightens, and then like a purse string, and then underneath that you have your stomach, and then it's grinding away, chewing your food, and it goes down into your intestines. But sometimes if you have a distended stomach, meaning it's got too much food in it, or gas, or there's other conditions going along, maybe obesity, where there's too much pressure on the stomach, it will sort of force some of that food up through the sphincter, or sometimes the sphincter itself is kind of loose because of different conditions such as pregnancy, or again, other health conditions, even diabetes, where that sphincter basically becomes a little loose, the purse string isn't completely closed, and then the food can basically go back up into the esophagus. So we want the food to just go in one direction,
right,
down. And for some people it will also travel up, and that will give them heartburn, indigestion, burping, bloating. There's also something called a hiatal hernia. Have you ever heard of that?
No.
A hiatal hernia is a very interesting condition where a portion of the stomach is actually up in the chest. And again, that happens because the diaphragm, which is the big muscle that divides the chest from the abdominal cavity. The diaphragm is sort of a little bit open around the stomach area, and a piece of the stomach can kind of poke its way up into the chest cavity. So when you're eating, a little bit of your food and gas and so on will end up back up in your chest, and it'll feel really uncomfortable, heartburn, indigestion, and so on. So these are all different ways that people can be uncomfortable from their diet.
So now knowing that, how can we encourage people, especially during the holidays, it's hard, right?
Yeah.
To cut back, or to prevent indigestion?
Well, I think the main thing, Mindy, is to really just listen to your body. If you're feeling full, stop eating. Maybe divide it into smaller portions, okay? Spread it out a little bit. And also listen to your body. Certain foods may make you get indigestion. You notice that when you eat cucumbers, or when you eat spicy foods or chocolate or coffee, you start to get a very unpleasant feeling afterwards. So listen to your body and don't overdo it on those foods.
Okay, and now what is acid reflux?
Okay, well, again, we were just talking about that sphincter, the purse string kind of closing, leaving the acid and inside the stomach along with the food. But again, if there's looseness there, acid from the stomach can go up into the esophagus. Now, we all are supposed to have a lot of nice stomach acid helping us digest our food, but it's supposed to stay in the stomach and not travel up into the esophagus. When it does, you feel that burning feeling, a very sometimes painful feeling in your chest, sort of down beneath your heart area.
Okay, and so how does stress relate to indigestion? I was reading a lot about that.
In a couple of ways. One thing is stress increases your stomach acid levels. That's one thing it does. And another thing it will do, it will change a little bit of that sphincter also. So you will have a higher risk of acid coming up into your esophagus. Another thing that happens when you're stressed is that you tend to indulge in the foods and alcohol, so that you might not find very helpful for your health condition.
And alcohol, I read, is actually one of the contributors to indigestion also, and acid reflux.
Yes. So typically the story will be that somebody will have a little bit of alcohol and a lot of food, and then feel uncomfortable, and then take a Motrin or something like that, which is also those anti-inflammatory medicines like Motrin or Advil. They really do aggravate your digestion there also. They will hurt your stomach, give you something called gastritis, which is irritation of the stomach lining. And then if you think of like a sore or like rawness on the stomach, and then pour acid on it, oh, that really does hurt a lot.
Okay, so when you have these symptoms, what should you do? I mean, Is it as simple as just going and buying some Tums, or?
Well, Tums does help because that's calcium carbonate, and that is basically a nice sort of coating for the stomach. It'll kind of calm things down a little bit, but overdoing it on the Tums is actually bad for you because it will kind of, in a rebound kind of way, make you get more stomach acid down the road. So limiting your Tums to just occasionally. You could also pick up something called Zantac or ranitidine or Tagamet over the counter. These are stomach acid medications, but this is all Band-Aid therapy, right? You want to go back to the cause and go, okay, wait, I've got reflux because I've been eating wrong and drinking and taking these medicines that aren't helpful to me. So trying to go at it the natural way is, of course, much better. But if you can't, then you can buy, Prilosec and Zantac and ranitidine. There's a lot of them, Maalox and Mylanta. There's just a whole industry about helping people with their acid reflux.
Okay, one last question before we throw to break is, when does someone realize that, okay, maybe I need to go see a doctor because the over-the-counter isn't working?
And it's not a laughing matter anymore when people have daily stomach acid problems, when they have acid reflux. It's contributing to all these problems. I can list some: asthma, sinus problems, sore throats, bad breath, and of course pain. And when you continually have reflux going on, you risk esophageal cancer. And also, you may be masking. You may not be aware that you actually have a stomach ulcer, and stomach ulcers are also associated with stomach cancer over time. So if you basically, I think the rule of thumb is, if you, after 2 weeks of taking whatever over the counter, if you're not better, you really need to go get seen. And sooner, if you're having any blood in your stool or black stools are a sign that you're actually bleeding from somewhere in your gastrointestinal tract. Meaning, if you see a black, tarry, very smelly stool, then that means that you've been digesting blood, and that's your own blood coming from somewhere, usually your stomach.
Okay, well, we will pick up our discussion on acid reflux and indigestion when